we have really nice weather here in London, but you're in smoky New York, Margaret. I feel terrible.
Yeah, the smoke is moving across the East Coast right now. So it's not, we waited so long for summer and now we've got smoke. So we have to stay indoors.
Mm. So why don't we, I think, why don't we just go ahead and start, I think. What do you think, Ismail?
You're on mute, Ismail.
Isn't that okay? Yes.
I think we can start, and other
yes.
people
So, okay. So why don't we just go ahead, start? So Joe, so I think, you know, many of you here, I think, would know that we had the terms of reference to really sort of, you know, based on the discussions last, the paper that we had produced based on a lot of the discussions that were happening over the last year and a half on measurements for care reform. And I think I don't want to waste too much time, because what we do have now is we've set of consultants, Joe and Elaine, who will introduce themselves to actually take us through the key deliverables, the process, the methodology. So this is what we call as the inception report. So one of the big things we had agreed with all of you is that we would come back with the inception report, the methodology for feedback. So there will be key points at which we will engage the task force on inputs in terms of how we're going to you know, undertake some of the key objectives of the terms of reference, and then also points at which you will provide input into the findings as well. So we do have a presentation that's been prepared by Elaine and Joe, and we'll go through them, which includes the objectives, their current thinking on how their approach, how they would like to approach answering the key objectives, and then some of the timelines for deliverables. So over to you, Elaine. I don't want to take up too much more time, but over to you, Elaine and Joe.
Thank you very much, Nalini, and thank you to all of us for welcoming us today to talk through the Inception report on measuring childcare system reform that supports family care for all children. If you have any questions or anything springs to mind as we're going through the presentation today, if you'd just like to make a note of those or put them in the chat box, we can return to them at the end so that we don't lose our train of thought. We'll deliver a presentation about the Inception report, but we do hope that much of the session today can be devoted to a dialogue and a discussion, and that we can really get your perspectives to inform as we take forward so that we can finalise this and tie it off. So just in case you don't know who we are, we thought we'd start by introducing ourselves. Joe, do you want to say?
Elaine, I can't see the screen in case, I mean, I can see that I'm looking at your screen, but I can't see the presentation.
I can't see anything, Elaine.
It's just like a black screen.
Well, I can see it and I don't know what to do. Do you want me to stop sharing?
I can share, Elaine, and you can just tell me to move to the next slide when you're ready. Does that work?
Yeah, I'll go out.
Okay, awesome.
I can.
1 second.
Yeah.
No, it's fine.
Now we can see your screen, Elaine.
Yeah.
Oh well, never mind. Okay.
Let's go back to
the eternal Zoom glitches.
There we go. Perfect. So
good.
Yeah, next slide, please. And Joe, do you want to introduce yourself and give a little bit of background?
Yeah, so I'm Jo Rogers. I'm a member of this task force and have tried to come to most of the meetings, but haven't always been able to. I don't really know how to describe myself. I work for an NGO, Partnership for Every Child, but I also do a lot of consultancy. I'm an associate with Oxford Policy Management, and I do a lot of work with UNICEF regional offices, particularly in Europe and Central Asia and in East Asia and Pacific region. I've also done some work in Middle East, North Africa region. Most recently, I've just completed, it's forthcoming, hot off the press, analysis of care system reform data from the TransMoney database, but also looking at other sources of data on children in care in Europe and Central Asia. That should be available and out towards the end of this month. Elaine?
Thank you very much, Jo. So my name is Elaine Salmon. My, I suppose, international career started in care systems reform in Europe and Central Asia. A lot of work on the reforms that were established to support family-based care for children, and in particular to work around the preventative development of social work and social protection systems. I worked in the NGO sector for a long time, then I was a UNICEF staff member, and then moved on to consultancy a number of years ago. I've experience in Europe and Central Asia, in South Asia, in East Asia and Pacific regions, in East and Southern Africa regions, particularly. And just because we are working on this piece together, Jo and I have worked on a number of pieces of work over many years that have to do with children's protection and development of systems, as well as the monitoring and evaluation of those systems. So yeah, thanks for welcoming us on board. Next slide, please. So just to refresh our minds about our terms of reference, the overall purpose of the assignment was to review the existing frameworks and tools that measure the progress and outcomes of childcare reforms at the system level, and then to map ongoing efforts to strengthen care reform measurement at the global, regional and country levels. So we really want to identify the gaps, make recommendations on how these gaps should be addressed, and pinpoint the opportunities for supporting the coordinated approach to care reform measurement. The terms of reference also describe 6 deliverables. The first of which is this draft methodology for the review and mapping exercise, which is described in more detail in the Inception report, and we'll talk about it as we go through today. When we get towards the end of the presentation, we'll return to the deliverables, because based on the desk review, we'd like to possibly make some very slight amendments to those deliverables, but we'll come back to that. So, as I said, this present Inception report is the first deliverable, and it gives us background based on a thorough desk review that informed the methodology for how we want to take this piece of work forward. So, next slide, please. As I say, it's the Inception report that we're going to talk about today. I'm not sure if you've had a chance to read through it and comment on it, but as I said, we're hoping for a good discussion today, which will inform the final version. Next slide, please. So what's the rationale? Why are we doing this? The terms of reference for the assignment is very clear that, you know, there's a lot of work going on around the globe at the moment on care reform system, on reform of care systems for children. Mostly, I mean, there's a lot of work in child protection, but a lot of it is around ensuring appropriate care for children who are without parental care or who are at risk of losing parental care. So pretty much our overall rationale is about our accountability to children for realization of their rights, and in particular, their right to a family. We're also concerned with, you know, going back to this wonderful precept of what gets measured gets done. So if we're not measuring something, how do we know if we're getting there and we're achieving our objectives for children? So care reform measures that are tracked and quantified in support of children's rights are more likely to be accomplished. And this can be achieved by improving data collection, information management, and reporting systems. We know that good data plays a very important role in supporting informed decision-making and promoting equitable inclusion in childcare reform of children marginalised because of their gender, because of their ethnicity, because they have a disability, or because they live in remote and inaccessible locations. We're also concerned about the children who may need support to maintain parental connections because they're refugees or asylum seekers and stateless persons. We also are, again, I mean, these are sort of key principles. It's founded in the belief that if we standardise the metrics for care reform, we can track progress across national levels, subnational levels, as well as have regional and global comparison data so that we can look at what is happening in other countries and benchmark against the best and move forward. Having these kinds of robust indicators and undertaking systematic measurement will also help with advocacy and communications, as well as measuring impact on children. Next slide, please. So as you will all know, because this is a task force meeting, but we elaborate this, the Task Force on Measurement was established as a subgroup of the Evidence for Impact Working Group. You have been reviewing existing efforts and approaches, and in particular, based on these discussions and exchanges, two very important documents have been published. The first you'll be very aware of, Supporting Countries to Measure Progress and Outcomes, which also has the logic model for reform of care systems. And then the second position paper, Supporting Countries to Measure Progress and Outcomes, that covers the same issues that we are addressing in this Inception report. That is, data is important, government should be in the driving seat. So this is about national level data collection that can be compared regionally and globally. There are also two very important recent papers on data and children in alternative care. We could say that these are seminal documents. The first is published by the UN ECE and conducted by the Conference on European Statisticians, and we'll talk about this a little bit later. But they have done quite an in-depth study and review about statistics and data on children, with a partial focus on alternative care and children with disabilities. And then, as Joe mentioned, there is a report that's very close to publication and public sharing, but we have been allowed to use some of the data that's contained in that within this report, which is taking stock of the situation of children in Europe and Central Asia. And it's, again, looking at the data systems. So these are two very important seminal documents that can underpin efforts to start to look at indicators and measures that we can propose, or that the Task Force on Measurement can propose through the Better Care Network, through the Data for Impact initiative. Next slide, please. So we have a very shortly touched upon where and with whom children live and why does it matter. Again, all of you on the task force will be fully familiar with all of the rationale behind this, but I think it's worthwhile reminding ourselves and touching base, and also keeping this in there because it's important for people who are perhaps external to this particular task force to really understand the drive, what's driving this push for good data. We know that children thrive if they have stable and secure relationships, and that, you know, the next best alternative in cases where they cannot live with their families is family-based alternative care. We know that 196 countries have signed the CRC, and in doing so, they have committed to making this family-based alternative care a priority. They are pretty much obliged as duty bearers to make sure that children are not separated from their parents. But how do we know that they are maintaining this obligation unless we are counting the children who are in care, who are moving between the different family care, family-based alternative care, etc. Despite the commitment, we know that around 3 million children all over the world are living in residential care facilities. And this is, you know, the estimates are so wild and variable. We know sometimes they go as high as 5.5 million. Recent data, I think from 2019, is suggesting that it could be as much as that. And one of the reasons, as we know, it's difficult to count. Children are uncounted and unseen for so many different reasons, and particularly if they are in private services or if they are in those services that are unregulated or in countries where there's no regulation. We know, for example, I mean, it's quite interesting that in Pakistan, the madrasa school educational system for children, many of which provide food and accommodation for children. I mean, the estimates go from 790,000 to as high as 2.26 million, and in some cases up to 4 million. So not knowing where children live is, or knowing where children live is important, because if we don't know where they live, we can't protect them. So it's very important that governments start to really systematically and regularly collect this data. It's also complicated, and it matters because there are no standardized definitions of what constitutes residential care. And so quantifying the number of children is very complex. And for example, as I'm sure you've discussed in the task force before, there's continuing debate around boarding schools, for example, including those types where children and families have taken an informed decision to enroll children, and those where there is de facto forced placement of children. So it's complicated and complex. And we also know that it's very difficult to source data on foster care. So because of this, and this is coming up in the 2 reports that I've cited at the beginning, data on foster care is very, very hard. It can be found in some regions, but not in others. So the sort of overall conclusion to this is that it's important to know where and with whom children are living. But at the moment, there is not enough data to really have a good full picture of what's happening there. And it's confounded by differences in definitions about what residential care is, what alternative care is, what family-based substitute care is, etc. And because of that, there is very little data measurement. And then the third part of the equation is the lack of variables on disaggregation. Again, we'll come on to it a little further. So moving on, next slide, please. As I said, collecting data on children's care systems means that we can better protect children and provide higher quality care for them. We talked about the fact that governments all over the world, 196 of them that have signed the CRC, have signed up to this. But there are several other very important global regional charters, commitments, conventions that are important for children's care and protection, that are important for children's right to live in a family. And, you know, the CRPD is critically important. We've got the African Charter on the Rights and Welfare of the Child. There are several treaties, and there has been significant discourse in the ASEAN region on this as well. There are also commitments for the Latin American, or for all of the Americas, in fact. So it's critical and crucial for states and development partners to track progress. And these 16 commitments on rights-based childcare systems exist to help that happen, but many of them don't have indicators, which is where those systems come in here. So if we can move to the next slide, please. So despite having these 16 commitments, there has been very little progress in measuring what's going on with children. There are no standard metrics. There are oftentimes within a country, there are different measures, and there are no country cross comparable measures for children in alternative care, children in families. And this really prevents people reporting even on the SDGs. And we in the Inception report, we pick out, I think, 3 or 4 of the SDGs, and we try and demonstrate why measuring what's happening for children in care can help meet the SDGs. For example, children in education. If we don't know where children are receiving an education, we don't know what's happening in a huge part of their life. It reflects on their development, etc., etc. So we'll be looking at that. And part of the rationale, therefore, is to help develop indicators that can help countries report against the SDGs. Over to you, Joe.
Thanks, Elaine. So next slide, please. So, as Elaine has said, there is globally, there are a lot of gaps in the data on children in alternative care. And we cited the sort of latest UNICEF estimate, which is 2.9 million, so almost 3 million children in residential care. And there are also some estimates from UNICEF of children in family-based care, but within both of those estimates on residential and family-based care, there are a lot of caveats about the quality of the data, comparability of the data. So there is a sort of an argument to say that trans money, which is, I think, as far as we could make out, there are some other regional initiatives around children in alternative care, but trans money seems to be the one which is drawing very specifically on a network of national statistical offices. So it's mainly looking at administrative data. Well, it is only looking at administrative data, but it's looking at administrative data across different sectoral ministries that have responsibilities for children in alternative care. And this is one of the main sort of constraints around data on children in alternative care that, you know, as we all know, health, education and social sector ministries all tend to have at least some kind of responsibilities and are gathering some types of data. Elaine also mentioned that, you know, we're very aware of the Data Care project, which Eurochild and UNICEF has been implementing, looking at European countries. And some of the findings are really quite astonishing that, for example, I think it's in France, that children with disabilities who are living in residential boarding schools are not monitored as part of the child protection system. And this seems to be quite common across many countries, that if children are placed for education reasons, then they're not monitored within the child protection system or the alternative care system, even though they may be spending months at a time, even years at a time in residential care away from their families. And similarly, there's another example relating to family-based care. The alternative care guidelines are very clear that kinship care and any formally arranged alternative care, whether it's foster care, kinship care, is formal family-based alternative care. It also makes clear that informal family-based care is a type of alternative care, but we'll come back to that in a minute. But the Data Care project showed that Portugal, for example, has the highest rate of children in residential care in Europe. 95% of children in alternative care are in residential care. And but this is partly because in 2008, the government took a decision to remove children in formal kinship care arrangements from the data on children in alternative care. And they call children who are in formal kinship care, they classify them and monitor them as part of family strengthening. So every government has a different way of approaching who do they include, which children do they include in the alternative care bracket, and amongst those children, how do they monitor and count them, which presents obviously very considerable challenges in terms of even within one region like Europe, which tends to have very strong data on alternative care, children in alternative care, there are very challenging issues when it comes to comparability. But on the other hand, TransMoney does offer a model. So it's a model whereby a network of national statistical offices have signed up to a set of indicators and signed up to definitions for those indicators. They've signed up to a method for how they collect the data and report it annually. And they do actually do that reporting. Over 30 countries are involved, and UNICEF is continually looking to how they can expand participation from, for example, other European countries in that region. So it offers a model of, one of the ways forward. There are constraints with the TransMoney data. No one's saying it's perfect. It does take time to implement a system whereby governments are having to adapt their system to a common set of definitions. And boarding schools, special schools, foster care, kinship care, these are the sort of common areas where there needs to be clarification and essentially agreement, but also around age groups. A lot of countries report on children who are already adults as if they're in the child protection system, and there's all sorts of issues. So there are some constraints, but nevertheless would like to emphasize that this does represent one of the ways forward. Next slide, please. So as I said, we've had a sort of look to see what are some of the challenges, and I've just described them in Europe, but there are very similar challenges in other regions around the world. And they do, these variances and definitions are consistently challenging everywhere. And UNICEF also talks about this in the estimates that they've put up globally, about how there are major issues with comparability as well as coverage for some of the data that they're using to estimate the global rates. And I think that, these sort of shifts and shuffles that I've just described in Portugal or in France, do you include children in the alternative care system or not? They can often reflect, some sort of issues that the government is sensitive to in terms of the policies that they're trying to implement, or where they may not be implementing policies but should. Children with disabilities particularly, very complex. Governments define disability in different ways, especially when it comes to children, especially when it comes to much younger children under the age of 3, under the age of preschool. So quite difficult to get a handle on children with disabilities, but certainly the data that is available shows us that they are significantly overrepresented in alternative care, and especially in residential alternative care. Similar concerns around children from indigenous populations, minority, excluded minority groups, for whatever reason, ethnicity, religious reasons, national minorities, child refugees and migrants, also very difficult. They tend not to be absorbed into or counted as part of national child protection systems. So they kind of either are being counted, but maybe not systematically by governments. And this leads to, gaps, big gaps in terms of understanding their situation. Some of this invisibility might be because of stigma and discrimination, a reluctance to admit perhaps in some countries that there are, for example, Roma populations very, very overrepresented in some European countries, or other minority child populations in other countries. But also in some cases, there may be legislation on data protection, which doesn't permit governments to classify children as having a disability or as coming from a particular ethnic minority, and therefore they cannot be counted. So there are issues there about data protection, which then leads to invisibility. Again, this is one of the findings from the Data Care project. For example, Sweden and Denmark have specific legislation that means the government cannot count children with disabilities in their child protection system. Next slide, please. So building on what's been done, first and foremost, a lot has been done. I think it's really important to stress that this isn't starting from zero, and we shouldn't start from zero. We should be building on what has already been done by the various actors, including Data Care, the Conference of European Statisticians, what UNICEF has been doing globally and regionally, and particularly in the Europe and Central Asia region, but not only. But we do need to be very aware that countries have very different capacity for data collection. I think one of the, some of the European countries may have similar systems and be using similar indicators. Some of them may have some kind of shared history that means that they gather data in a similar way. But generally speaking, there is a great deal of variation in terms of the context and the capacity for data collection. This isn't going to work. It's not going to be possible to create any kind of globally comparable indicators and data if there is no agreement from governments, and it seems very clear that governments do have to be in the driving seat, and this was one of the conclusions of the position paper that the task force developed, and we absolutely agree with that, that without governments, without national statistical offices, without ministries and their administrative data sets, then this could just never happen. So therefore there's a need to reach common agreement on common definitions, at least for some basic indicators. And this is certainly the recommendation that came out of Data Care. It's the same recommendation that's come out from the Conference of European Statisticians and the latest TransMoney analysis on children in alternative care. So, specifically definitions on formal residential care. What does that mean? What should be included? What shouldn't be included? How, and clear descriptions, metadata for formal residential care, formal family-based care, at least as a starting point for collecting, comparable data. And then also using agreed definitions in order to have some key disaggregations, age, sex, and disability, at least as a minimum. And that this, based on what's been done so far, this is probably realistic. This could be done. It's achievable. And that's what we need to focus on in our inquiry. Next step, please. Next slide, please. Next steps. So these are the 3 indicators that have come out of Data Care, the Conference of European Statisticians and Transmoney, with slight variances. Yeah. The first is to look at the number of children in formal alternative care at a specific point of time, so the end of the year, let's say, with disaggregations by girls and boys, age, I'll come back to age in a second, disability and, if possible, ethnicity, but certainly disability, I would say, as the, our recommendation, or at least that we need to sort of explore as we take forward this assignment. And be able to disaggregate by type of care. So number of children in residential care, number of children in family-based care, as defined by the agreed definition. And then looking at inflow and outflow. So the number of children who have entered during the year or a different period of time, but they're recommending the year, again, by sex, age, disability, and type of care. And then the number who've left. So this will give, if these are collected as the minimum, and it's quite a lot to ask, especially with the disaggregations, but if these are collected as a minimum, it would give a basic picture of what's happening in any given country in terms of the stock and the flow of children into and out of alternative care. Next slide, please. So having looked at the landscape, having looked at the position paper that you've already developed, having looked at, what's been done, especially in the last 2 or 3 years, having looked at what UNICEF has been doing globally with its toolkit on children in residential care, to try and audit children in residential care. We want to suggest that the best way forward is to sort of think about the United Nations Economic Commissions, the regional commissions. So there's the European Commission, which is UNECE, which has this Conference of European Statisticians, which has, convened a task force on children, adolescents, and youth, which has recently, done a big review, not globally, but wider than Europe. It includes North America, includes quite a number of other countries outside of Europe, and have come up with recommendations. So we're proposing that that comes as a sort of starting point. The Conference of European Statisticians actually has quite a wide reach beyond beyond Europe. It has traditionally worked, it's quite an old body. I think it was established in the 40s, in like 1947 or something. Goes back many years, and it sort of includes, it has worked with, Brazil, China, various other countries outside of Europe. So we want to suggest looking at that as a regional platforms, which has a remit and a mandate on statistics. So these economic commissions, they're called slightly different things in different places. The one in the Asia and Pacific is the Economic and Social Commission, same in Western Asia. Otherwise, they're mainly economic commissions. And, they have, because they've got this particular remit about statistics, they have the potential to, link into government national statistics offices. At least this is the way we're thinking, and this is what we're proposing we explore in this assignment. Next slide, please. So our proposal is essentially to take forward this inquiry, to conduct interviews with key informants from the economic commissions, the regional economic commissions, several key informants from the UNECE statisticians, European statisticians, Conference of European Statisticians, data care, people who were involved in data care, so the UNICEF regional office, Eurochild, Transmoney, again, that's the European and Central Asia regional office. And then with UNICEF headquarters, I see that Nicole is here, so good to get your immediate feedback, Nicole, but also the regional UNICEF offices as well. And the questions we would be asking would be around, what is the feasibility and validity and the potential for, robustness and validity of using these 3 indicators with those, 9, 12 disaggregations. To what extent is that feasible, possible? To what extent is that kind of data already being gathered by the governments in each of these regions? And, what are the next steps that need to be taken to sort of move towards having a global set of indicators and a globally agreed set of definitions? And, what is the appetite for this, and what needs to be done to really sort of push and take the next steps? We also propose holding some interviews with a selection. We can't do many because we have a limited number of days in this assignment, but with a selection of national statistics offices. And our proposal is to choose the ones that have large populations. So we were thinking, for example, China, India, Nigeria, from each region, Brazil, that have these large populations, so that we can really get a handle on, what kind of data they already have, what are the challenges, and to what extent do they think this is something they would want to engage with. So, obviously, I think we estimate about 30 interviews that we can do. Some of them will be group interviews maybe, or we will to conduct them as group discussions. There's a limit to what we can do in terms of exploring this as an option. But we think it's, the right way to build on what's already being done by so many other actors. And it's almost like a consultation on the CES and data care recommendations. The deliverables, Elaine, I don't know if you want to run through these, what we're proposing to slightly change compared to the terms of reference.
Yeah, thanks, Jo. They are minor amendments, but I think we just wanted to say, well, the draft inception report is available. We hope to have feedback from this meeting and anything else consolidated and referred back to us by the task force, rather than receiving individual comments and thoughts, so that we can finalise this by the 23rd of June and then move into the consultation phase. Again, with the support of this task force, we will be looking forward to your thoughts and your assistance in identifying the key people that we will need to talk to, so that we can talk to them in July. And timescales are very tight, but this is coming from the terms of reference, and we're going to try and adhere to this if it's possible and feasible to capture people over this particular period of time, which in some areas is considered or maybe complex because it's holiday time. At the moment, we will produce a draft report and then deliver that report and a presentation by the 4th of August. The next one is the agenda meeting notes of 3 working meetings with the task force on measurement. So again, here is, we feel that it's important to go back to the task force and almost have an online working group meeting to talk through the work, what we're hearing from the people who are working in national statistical offices, who are involved in that sort of macro level data collection. And we're proposing 3 meetings to try and take account of time zones across the globe, so that we are making sure to include not just Europe and Central Asia, where a lot of work's already been done, but that we do look at the Americas, we do look at South Asia, East Asia, Pacific regions, because they are critically important to this if we're going to be looking at national and global comparative data. So that would be to have 3 meetings. Again, it's a working group to bring forward the recommendations and try and fine tune those so that we can come up with, as the task force, rather than just Jo and I, so the task force can come up with recommendations and that these can be formulated in such a way that they can then be proposed by the task force to the authorities who have the feasibility to try and push to have these things taken forward. And then they'll have a final process report. So I think it's just the tweak there is really about these working groups rather than anything else as we move forward. Okay, Jo?
Yep, thanks. So the next slide summarizes the sort of interviews that we want to do, or we're proposing to do and want to discuss with you. And we would need your help, all of you, in terms of reaching out to some of these people. Some of it we can do ourselves, but certainly some of them we will definitely need help from the task force and from UNICEF and from other partners. Next slide, please. So to sort of conclude, the position paper talked to some extent about outcomes measurement and discussed the fact that there are many instruments that are being used by different task force members, especially by non-government actors, although some governments also have instruments that they're using to measure outcomes for children in different care settings. And this, what we're proposing is to not ignore that, but rather to try and build on the kind of macro situation, which is that there's a lot of interest at the moment in terms of, trying to find some indicators that can generate comparable data at the kind of macro level, at the systems level, which does enable measurement of outcomes from care reforms as far as systems are concerned, not for individual children, very limited in terms of what it can tell us about how care has impacted on individual children, but it can tell us whether a government has put in place let's say a deinstitutionalization policy or strategy and action plan, and it will show us, is that having the desired effect in terms of numbers of children in different types of care, and it will tell us if there are children being left behind by those reforms. Are some children, there are many countries that have tried to engage in deinstitutionalization, for example, only to have a continually growing percentage of children with disabilities in residential care. They're the ones who are being left behind. And a very small percentage of children with disabilities in foster care. So these indicators will show us some of these things at a very sort of, macro level, but at the national level, where the data is being collected, it should also enable national governments and NGOs engaged with national governments and UNICEF and other organizations advocating around alternative care to look at subnational issues. If these become adopted as, just standard indicators that everyone reports on, then it will enable the gathering of data in a more granular way than currently takes place, and therefore allow for subnational analysis as well, which is incredibly useful for national governments and for advocating around reforms within any given country. The other thing that it will give us is a way of, looking at the work that's been done with census and DHS surveys mix, which not all countries conduct. They all conduct a census, but not everyone does mix and DHS. So therefore, we're slightly limited in what we can do with that. But if these three sets of indicators with their disaggregations are systematically gathered, then we will be able to see some of the outcomes related. So it should become possible to then somehow link with census and see that, children who are coming out of, education outcomes for children who are coming out of particular types of care will become more possible to see. As we can see, for example, with mix, in countries that do mix, we can see that living arrangements, children in certain types of living arrangements, children living without a biological parent, have very different outcomes in terms of health and education, for example, than children who are living with close family members or with parents. So, I think that that building up this more granular data than we currently have, even if it's only for a few indicators initially, will offer a way forward on looking at the more, the deeper issues of outcomes measurement that we're all so interested in. So this is our proposal. This is what we are proposing to do. And we're very interested in your thoughts. I don't know if it's helpful to go back to the previous slide to have that up while we
Thanks,
have the
Joe. I think
discussion.
what we've done. Yeah, and I think what I've done is because I know I can't read chat, unfortunately, just for all of you, because I'm logging through my UBS computer, but I think I did share the paper via Margot, and I hope that is posted in the chat. I can't see it, but I think hopefully you will have access. So that's a draft that this presentation is based out of, just so you're aware. So you could obviously, continue to provide feedback to Joe and Elaine, based on that draft. But initial reactions and thoughts, please welcome. But I don't know if you wanted to finish by any specific question you had, Joe, Elaine, anything more specific other than a general opening?
No, I mean, I think we're just very interested to know, whether you have any further suggestions. Have we missed something important? Do you think this is, doable given the limits of the resources that we have at the time, the numbers of days that we're going to be able to spend on this?
Yes.
And also just to, I had a quick look at some of the things that were coming up in the chat. So somebody had mentioned special schools, and yes, we do go into more detail on that. And we do know that, in certain parts of the world, special schools accommodate children who have disabilities or who are marginalised in other ways. And we are aware of the fact that UNICEF in Europe and Central Asia is preparing a white paper on the issue at the moment. The split between what's residential care and what's boarding school. Another question came up about foster or kinship care. Yes, we're very aware of the fact that foster care and kinship care are hot potatoes at the moment. And also this confusion, or not even confusion, but the lack of definition in terms of what's formal kinship care and what's informal kinship care. And should informal kinship care be counted alongside formal kinship care? There are so many reasons why it should be. Although people will push back against that. Somebody else asked about reflecting estimates from other studies that are higher. And yes, we do include that. We try and look at the range of data that's available, that's out there, which leads us to this very confusing situation where we don't really fully understand what's going on, and that these estimates are so different because there are no standardized definitions on the system. And then somebody else mentioned the Data Care Project, and yes, we do reflect what's been going on with the Data Care Project. And I think it was the Data Care Project, the review of the trans money data, and the UNECE report, where we have formulated the proposed indicators that we're hoping that we can focus on when we go to consultation. So thanks. And now over to you. I see.
Thank you. Thanks, Elaine. We've got lots of hands up, so I'm just going to go from my screen here. So Severin, you're first on my screen. So go ahead, please. And then Joe, and then Nicole. Yes, go ahead.
Thanks, Elaine. It's so good to see you. It's been too long, and Joe, always a pleasure to see you as well. Great presentation. I haven't read the Inception report, so apologies, but if some of my comments might not be totally informed, but we'll definitely, now that I have the link, we'll be eager to download and read. A couple of thoughts that came up, and first of all, it felt, and my memory is a tiny bit fuzzy, hence why I was asking for all these links. It feels a tiny bit of a departure from what we had originally discussed as the task force, where there was a huge focus around really mapping the tools that exist to measure And so, but maybe that's already done and in the inception report, and we're already moving to the next step, which is the recommendation, which would be great. So that's my first question. In regards of definition indicators, agree, super, super critical. I think I'll pass it on to UNICEF and to D4I, because my understanding is that indicators have been developed and are currently being tested in a couple of countries. So making sure that we reflect that. In regards of definition, that is a constant in our sector and a fun topic. And my understanding is that the Transforming Children's Care Collaborative was going to set up a working group specifically to tackle the definition. And just want to make sure that we're linking that, whatever that effort, or maybe we merge them and we say this work, it just seems like a big, big undertaking to do the definition in addition to the mapping of measurement tools, which was originally what I think we had envisioned with this work, but happy to hear more. And I think that's it. Again, so great to see you both. Take care.
Do you want to, I don't know, do you want, maybe we just take all three and then maybe Joe, Elaine, you know, you could do that. Yes, thanks. Go ahead, Joanna. Yes.
Thanks.
No, because Joanna, so many.
Yeah, no, really great to hear all of this. Really interesting. Nice perspective on it all. I had the same thought as Sev around feeling like we already done the mapping and review. That was what I was expecting in the Inception report. I thought the Inception report was going to be how we do the mapping and the review. So maybe that's already in there. And like Sev, I will definitely have a read and see what we've got. I think I was a bit confused and I got invaded by small children, if you saw me being distracted, at the point when you were discussing the regions. And then I was wondering, are we missing a couple of regions? And if there's a reason for that, it felt like you weren't mentioning Latin America and Africa. And I maybe missed the part when you explained something around that. On the final bit around the outcomes, I guess in my head, and this may just be how I think about it, there are the outcomes at the child and family level, and agreed that that wasn't the scope here and is like a massive minefield. But the outcomes more in terms of the changes in the systems itself, is that something that we're looking at beyond the numbers of children in the system? But Joe, you mentioned like putting policies in place, that kind of thing. And I know that's kind of got at through more of the care system assessments and those pieces that are out there. I just wondered if that was, are we looking at that? Because I think those outcomes and understanding kind of how systems are aligned with the UN guidelines and therefore how the numbers in the system, the numbers of children in the system might be shifting. I think you kind of need both of those pieces of information. So I was wondering if that's something you've already looked at, because there's quite a few different initiatives going on around that piece. There was a third point, which has now eluded me, but yeah, I'll leave it there. Thank you.
Thanks, Joanna. Nicole?
Thanks, and thanks so much to the presenters. Actually, my comments are very similar to the ones that Sav and Joanna gave. So the first is around sort of the scope of work for the assignment. So I think I had also understood that the idea for this initial piece of the work was to do this sort of mapping of what's being done so that we can get a handle on what are the different, you know, there's a lot of different initiatives going on. There's different groups working on different things. So I had also understood that that was sort of the idea partially behind the assignment was to be able to really like map that, and then being able to see this mapping would help us maybe identify, I think, a little bit where is there gaps, or is there areas maybe where we're missing, or things that are where we need to, you know, plug the holes and fill in some things that, you know, there's efforts maybe or initiatives that we need to create or start that are not, you know, already in process. So that was also a bit my comment. And I also, apologies, didn't look at the inception report in detail, but I did just quickly scan through it, and it didn't seem like that sort of mapping was there yet. So so that would be good to clarify. And then I think my other comment was in relation to I think what Sev was bringing up about around indicators and this sort of thing. So I was also a little surprised just to see that there's, you know, possibly an idea to put forward some recommendations, I guess, about a couple of indicators. And I'm not sure if the idea is to put forward those indicators and then try as a task force to like take that forward and like get those like adopted or something as like an international standard. But that's something that like we've been thinking about in UNICEF and with the work that we've been doing. And doing some you know, collaborative work with D4I, as Sev was mentioning about, you know, making sure there's some alignment and harmonization between the larger set of care system reform indicators, performance monitoring indicators that D4I has been working on, that mapping they did of, you know, over 100 indicators, and then paring it down. We also developed in UNICEF, or have, you know, put together a list of, you know, 24 kind of minimum recommended core indicators that form part of the assessment for the diagnostic toolkit that we've developed. And we ensured that there was overlap and alignment between the indicators in our set and the ones that D4I has, where they're, you know, where it makes sense, because the ones from D4I are much broader in terms of monitoring all of the different elements of care system reform and performance management, whereas ours are much more narrow in terms of the focus. But we already did this sort of initial, you know, consulting between UNICEF and D4I to ensure that there's harmonization there and that we're not, you know, putting forward something that is not consistent. And I mean, the 3 indicators that were put up on the screen are, you know, are in the set that we have, and I think probably are in the D4I set as well, because those are pretty standard, you know, pretty common ones. But I think it wasn't clear to me what the thinking or what the, you know, sort of idea is around those indicators, if we're thinking of proposing those as a group or something. Anyways, it would just be helpful to understand that, because we kind of have a bit of our own stream of work going on around indicators in UNICEF. So we just want to make sure we're not duplicating efforts, or you know, we want to just make sure that there's harmonization and alignment between, you know, whatever everyone's doing. And then just a final quick point on terms of definitions. You know, I think that we have, you know, the guidelines for alternative care. I mean, the UN guidelines provide, you know, kind of like a conceptual definition, right, of like some of the key terms, but of course we're lacking still like very concrete, like operational definition. So I wanted to clarify if that's what we're talking about when we're talking about coming with agreed definitions. Are we thinking of more like a taxonomy, like a statistical definition, an operational definition of, you know, residential care, formal family-based care? Because of course we have the UN guidelines that sort of set the big parameters, and they're useful in that they provide a conceptual definition, but they're not useful when it comes to statistical measurement, because they're too vague in a way. But I just wanted to clarify, if when we're talking about definitions, are we talking about those type of more specific operational definitions, like a statistical definition, a taxonomy of like, how do we, you know, what types of residential care are we talking about, and really like more of a statistical definition rather than the ones that are in that are in the guidelines. So those were just a couple of my initial comments. Thanks.
Should we respond
Go
and
ahead,
then
Joe. Yeah,
take
yeah.
some more
Yes,
questions?
yes. Yeah.
Do you want me to,
yeah.
shall I go first, Elaine?
Yeah, go ahead, Joe.
So, yeah, thank you. All really good, interesting points. I mean, I think in terms of to what extent we're doing what it says in the terms of reference, I mean, I think that's up to you to tell us at this meeting. So we haven't mapped instruments, but I do think we've mapped existing frameworks and maybe not tools that measure the progress and outcomes of reforms at the system level. So I think you know, what we could see, I mean, it hasn't been, no, we haven't done a deep dive. That hasn't happened yet. And if that's what you want us to do, then now's the time to say. But what we have done is to look at what's happening across the whole landscape when it comes to measuring system change for alternative care systems. And, you know, there are these big pieces of work that have just finished from the Conference of European Statisticians and from Data Care. And the latest TransMoney analysis, which is going to come out quite soon, which has also looked at this question of you know, data quality and indicators and comparability and coverage and so on. So and what we can see, what we're sort of coming back to you and saying is, look, you know, there is clearly a lot of work that has happened in terms of trying to get a grasp on what kind of minimum core indicators there could be that are realistic to collect data on, because data exists, at least in these countries that have been looked at so far by the Data Care and the Conference of European Statisticians. So if the task is to try and sort of take a next step, then our recommendation is that we focus on these 3 indicators, because there has already been an in-depth review in, you know, 50 odd, 60 odd countries saying, yes, this data exists. Yes, these disaggregations exist. Yes, you know, it is possible to start talking to people about refining definitions to some kind of a, you know, defining it in a way that data can then be collected for statistical purposes. So what we're suggesting is, now we need to look at these other regions. Are they collecting this kind of data? Is it available? I mean, if what you're saying is, well, we have a list of 24 from UNICEF, a list of 100 from Data for Impact, you know, that's the starting point, then that's another task. That's a slightly different task. So, and we can do that. We can take it from that. You know, we can say, okay, here are the indicators. Let's go and talk to all these different statistical commissions and, you know, national statistics offices and discuss. Because I think what we see this is not about making a recommendation. We're well away from making any recommendations, but we're taking recommendations that have been done by others and then suggesting that we go out and consult on them in other regions and with other organizations and with other networks and see what comes back. If everyone says no, not possible, or no, because it doesn't include XYZ indicator, which is as important or more important, you know, then that's where we develop the recommendation once we've actually talked to people. So the question is to you is, you know, what do you want us to go and talk to people about? Is it to find out, you know, the tools that they're using? And if that's what we want the focus to be, then we can make that the focus. Or is it to say, look, this work has already been done. You know, these are the recommendations coming out of it. What do you think about that? So,
Deb,
and then, yes, I do think that the next, sorry, can I just come back to Nicole's final point?
Oh, no,
you know,
please
what are we
go ahead.
exactly
Yeah.
talking
Yes.
about in terms of a statistical definition or a taxonomy? I would say yes. I would say that that has got to be the next step. Not now, not us, not in this assignment, but in terms of, you know, if we're serious about moving forward towards having the ability to collect comparable data across the world, across all the, you know, all countries, using administrative data sets that are then sort of filtered through the National Statistics Office, then yes, that's the next step, is to come up with, you know, definitions related to the alternative care guidelines that can be used in practice. And I think there are 2 areas where the alternative care guidelines are fudgy, deliberately so, I think, initially, and that is on boarding schools. Yeah. And because if you use the official definitions in the alternative care guidelines, then all children in any kind of residential care, doesn't matter whether it's a boarding school or a sanatorium or even a hospital, yeah, they are outside of the care of their parents, therefore they are in alternative care. So it's quite clear on that. But then when it comes to boarding schools, it becomes a bit kind of, well, that's not quite, doesn't quite apply here, and blah, blah, blah. And it's been left to hang. And I mean, now, not with my consultant for this particular assignment hat on, but with my other hat as a sort of, you know, someone who works for an NGO who's been very active in this field for many years. You know, I do think the time has come to revisit this question of boarding schools. And it is a grey area in the alternative care guidelines. And that's why it's so difficult to measure. You know, the diagnostic tool that UNICEF's developed, it all depends on which residential facilities you apply it to. You know, the test in Kazakhstan, they didn't apply it to any of the boarding schools. So we don't know, even though we know that in Kazakhstan, there are boarding schools that are specifically designed and intended for children who are poor or who come from large families. You know, they're there for social reasons. So, you know, I think that there has to be a greater coherence around, you know, clarity around what exactly are we talking about here, and that this is one of the ways to do it, is to sort of consult with people on these recommendations that have come out of this huge work that's been done by the you know, Data Care, Conference of European Statisticians, UNICEF, globally and in various regions, you know, and take the next step and say, well, what do you think about these indicators? Are they realistic? Can your national statistics offices gather data on these? But maybe, you know, I mean, but you're the ones who have to tell us what the task is. So, you know, we're happy to
I don't know, maybe Seb,
adapt.
yeah, maybe Seb, did you raise your hand afterwards? You raised it again, right? Seb, I think, yeah, go ahead.
Thanks, Joe. That's super helpful. Totally agree with you around definitions. And I would add, in addition to the boarding school, you know, the whole fuzziness around different type of residential care, you know, specifically with the small group homes, etc. That would be fantastic to, you know, to have some agreed standards, and that informs statistics and all that. Yeah, I feel, and again, I'm kind of brainstorming and really looking towards others, but I feel like you're already one step ahead, where you're already saying, okay, well, we did the review and this is what we recommend, which, you know, I'm open to that part. I think we were a bit slower in our envisioning of this work, where we really were thinking of like, okay, let's take time to really take stock of all these different tools that exist, including all the amazing work that is happening in Europe, which we think is super strong and something we could build upon. However, recognizing, as you mentioned, that care system and other regions are extremely different and underdeveloped, etc. So that's why the idea was to really look at all these different frameworks and measurement tools that are being used in different contexts. So, you know, all the UNICEF diagnostic tool, the enumeration tools, all those kind of efforts there, all the D4I tools, the BCN assessment tool as well, you know, all of these different measurement that and frameworks that exist. And I think everything's been kind of developed, not always in the most, I'm trying to find a nice way of putting this, but let's just say it, we're between friends, not always the most coordinated way. And so kind of reinventing the wheel in some instances. And so we really felt, let's take stock and make sure that we're not developing yet another tool, another framework, etc. And we're really making sure that we're linking everything that's already happening, and that will help this group come up with key recommendation, okay, of saying, all right, so, and I feel like you're already at those key recommendation, which I think is brilliant. I think we just need to catch up with you, basically. So, or you need to handhold us a tiny bit more in that process. Those are my initial thoughts.
Hasmik? Thanks, Sev. Yeah.
Yes, hi everyone. I'm Hasmi Kasan from B4I Armenia. I'm so thankful for your nice presentation and all the hard work that you have done. I'm really impressed with how deep you go and very nice analysis you presented. But I would like my questions about special schools and kinship care. I think that yes, alternative care guidelines are providing good definitions, but they are very weak. I will agree on boarding schools because they are we cannot how to say our debates with the Minister of Education were not finished with our victory. we lose there because they said that the boarding schools are providing education to children who cannot get the education in other places of the country, and these children are and the special schools in our country are only for children with disabilities. And so if these boarding schools will be closed, and we have closed several of them, we now see that these children are remaining at home without any education because the home education is poor. There are no other alternatives in the mainstream schools to provide the premises, the conditions for these children to study. And so the only way these children can get education is the special schools, at least in the countries like our country is. I will say that for definition and based on my practice, what we have come up to agreement with our government that we maybe can consider children who go to this special school and stay overnight, and only to count those children as children in alternative care. But children who go this school and then return back to their families, they are not in alternative care because they are going back to their families. But those who are remaining overnight, and because remaining overnight and because there is no other alternative services for them in order to stay with their families, then they can be considered as in alternative care. So this is one solution. The other problem that we are facing with kinship care is like most of the kinship cares are with the children are staying with their relatives, and the relatives are not registering this kinship care, and there is no any statistics how many children are staying with their grandfathers, aunts, cousins, etc., because of their parents had to move for study, for work to abroad, and there is no any mechanism to force the families to register this kinship care. And this will be another support, like to mention and to help also us as statisticians to understand so what we are going to count. If the child is staying in the same home, in the same family with their grandparents and but not with their biological parents because the parents are abroad, is the child considered to be in kinship care or in family? So this type of things are still a lot of making a lot of question marks for us to collect good data. And I will say that for another perspective, what we have done in Armenia, and I basically with our UNICEF team, we just compare the 4I indicators that we developed for monitoring of our care system, and also their Transmona indicators, and we merge them. So we make we provided to our government, like to ministry, one set of indicators that include both wider scope, like so that they have all type of alternative care or care system components with these indicators to monitor. Plus, we also say that when you receive requests for Transmona, you can use this indicator with this disaggregation and report to Transmona. And now we are in a process to negotiate with statistical committee to start collecting that care system indicators so that country will have one set of indicators and can be used for different purposes. So this is something that we are trying to work on. I think that you have done great work. I think that the work that you are doing will be very helpful for us. And this much I will say. Thank you.
Thanks, Hasnik. Yes, Elaine, go ahead. I think we have a few minutes left, and just go ahead, please.
Just to come back on Joanna's point and perhaps reassure you that Latin America, Africa, the whole world is included. That's why we want to focus on these economic commissions, because they cover all of those countries in a sense, and that's why we want to come back to them. We are also making sure that we are including countries all over the world, not just low and middle income countries. We're looking at what's happening in Australia, what's happening in North America, what's happening in Canada, you know, as well as everywhere else. And they should be able to report equally in the same way that everybody else should. So it's about, you know, we are at a macro level here, and we're at a level that's saying, yes, each country should have a very, very broad range of indicators and data that they're collecting on care systems reform. But at a kind of a macro level, there are countries where there is no data whatsoever, and children are at risk because of it. And I go back to almost the very first point is, why are we doing this? We're doing this so that children can be protected. And, you know, if the first thing that we need to do is to try and get them counted so that governments know where they are and who they're living with. And the debate and the discussion is that you've all done so much work so far to kind of come up with a couple, 2, 3 indicators as a starting point, that if they can be accepted globally and people can start to collect that data, then more will come behind, we hope. But if we try and propose something that's complex and difficult, then there will be no chance whatsoever. There was something else, yeah. And then just finally on our colleague who just mentioned Hasmik, about the special schools and counting, and government saying there is no alternative. There are lots of alternatives to educate children with special needs. There are lots of them. They just need to take it on board. And one of the ways they will take it on board is by counting those children and counting them as being in residential care. So whilst I think we all understand that everybody who's involved in this whole sector is very focused on outcomes for children, and we're kind of looking at it at a more macro level to kind of say, if you want somebody to do something, we've got to try and get everybody to at least start counting at the same level. But we look forward to more feedback.
Yeah.
And we hope that you
and I think sorry, I know we have a few minutes. Maybe if you can just answer your response, Joanna, in a minute, and then I just want to just highlight what we might do next. Maybe Joanna, I don't want to. You raise your hand. You wanted to respond to something? Yes.
Sorry, I thought you were talking to other.
Oh no. No, I know there are 2 of them. I know I'm in my screen. I'm talking to you. No. Go ahead. Is there anything you wanted to?
I just wanted to reiterate what the point that Sev was making. Like, I think the work that has been done is really interesting. And I absolutely agree that we need people to be counting the children in the care system. But I think we need, as a group, to be taken on a bit of a journey and to understand not just those European initiatives that are out there around measurement, but globally what is going on around measurement. And there's more than what's happening in those few that you mentioned. And maybe there are others in the report. I will go and read it. But I think also part of what we're asking is for you to help us to reach those recommendations. And it maybe they're the recommendations that you're saying right now. We need to be part of a process to get there.
Yeah. And I think, and so maybe I think this papers, we will send it again on the platform as well. And I think Margot has posted it in the chat. I can't see, but I think she has posted it in the chat. Feel free to comment on those. But I think, if I may, one of the things that struck me when I did read the Inception report, and which I didn't want to change anything, partly because we have been dominated, very frankly, in my view, just I'm coming from outside, there's a lot of discussion on what's happening with UNICEF, with a lot of it being dominated what's happening in Africa with some of the some of the initiatives that we all have been involved in. And it was quite refreshing to actually see. But I think what's happened, Joanna Wakia, is sort of, I think we need to sort of bring the two together to see there, because some of that is not reflected, and the journey as to why we want to take this macro view is sort of perhaps was one of the first objectives, and that journey probably is where I think Jo Elaine is something that we can agree as sort of that's the first thing. I think you've covered partly when I read it. There are some aspects you do have it there, but you have it. It's slightly different from the way we have sort of covered it internally here, because we've taken a systems perspective, we've looked at different parts of the systems and so on. But I think what you are suggesting is that how that is still valid, but then how do you then take that journey to a minimum set of indicators that you can collect through existing administrative systems, and that's comparable? Because today, some of the indicators that we are discussing is still not there, but maybe that journey and why this recommendation is probably needs to be sort of that transition is sort of missing, if I may. And I think what we have now is a set of 3 indicators. How are we going to do this and so on? Whereas I think where the group is saying is we wanted to first actually see why this recommendation and how do we get there. So I think there is some of it is there in the paper, and I think there are aspects that probably is missing. It's there, and I think it's probably not explicitly mentioned, and maybe I think others can comment on that as part of the feedback. And then I think what we'll do is we'll just have a conversation and see if there's one more meeting that might be helpful, one more call that might be helpful, just to agree if this sort of then addresses some of the comments that have been mentioned today. I don't know, that's sort of, I think, and we'll come back to you what dates and so on. But I don't know, Jo Elaine, if there are other things that you wanted to mention before we sign off. But I think this is really helpful. Personally, I thought it was quite refreshing, a very different set of, but I think just that journey to how we get there. But I think, I found it very helpful. And I think it's kind of a different perspective. I don't know, Ismail, do you want to say anything before we sign off? I know we're a minute over. This is my Swiss hat.
No, I think a lot of it has been said. It's just going back to the terms of reference and making sure that, of course, I do recognize from this conversation, probably we are about 3-4 steps ahead. So we need to just go back and get to the drawing board and think through what we want to get out of this exercise. And it's quite clear from the terms of reference, it's about, it's more or less a scoping review of existing measurement frameworks and tools, as well as ongoing, measurement strengthening efforts. So I think that should be the starting point. And then we can get into, conversations around, what the minimum set of indicators should look like, and, and definitional issues.
I don't know, Margot, did you want to say something?
There's a question from Joanna in the chat asking about how we will coordinate comments on the report. What is the best way to do this? That perhaps we do an online version so that everyone can comment at the same time.
I think that was what I was thinking, because I think the last time there were comments on that we put it on the platform. Does that work, Margot? If people comment on the platform, we will be able to, and I know Jo and Elaine have access to the platform, so we might just give you a certain within the next 2 weeks. Does that sound like a reasonable time frame? Is that clear? Is that possible for you? I think that last time I saw some comments coming in on the platform, so I'm hoping that we could still do the same if we put it up on the platform.
So I think what Joanna is maybe asking is if you want comments in an online version of the document as opposed to doing it in comments, because then you have to sift through comments.
You could do either. I think we've received both ways, Joanna. We've also received comments on the document itself, and some people have rather chosen just to give feedback as a summary as well. So I think either way is fine. And you could put that summary feedback in the document, or you could put it a separate chat within the platform. And I'm talking as if I use it.
Nalini.
Yes,
so
that's our job.
all, that's your job. Okay.
I mean, when I say, oh God, this is what am I doing? I don't even.
I would suggest
no, but
sticking
I
it in
think we
Google
go
Docs
in,
so we can all comment in the same place. But
and maybe that's what. And I am the last person. I should shut up and not talk about how do we do this, because I don't know. Ismail, do you? Somebody said something. Oh yes, Marco.
Yeah. So I agree with Joanna. I think doing it in one Google Doc would be the best, and then you can actually see who it is that commented. So if that's okay with you, Nalini, I can do that and then post the link.
Thank you, because I don't have access to Google Doc or any such thing, so that's why I have no idea. So
Yeah, no
thank you, Joanna, for raising that important question. Thank you, Severin. Thanks. So we will carry on, and I think this has been really helpful. And let's come back again once we have everybody's feedback, and we'll also have a conversation with Joe and Elaine separately. Thanks all. Thank you very much. Have a wonderful rest of your day, and wherever you are, thanks for joining. Bye-bye.
Bye. Thank you.
Bye. Thanks.
Yes. Thanks, Margot, for hosting.
Yeah, no problem at all. So what I'll do, Nalini, is I will put, do you want me to put the terms of reference together with the draft inception report in one document, or is that completely separate? You don't need people to comment on the terms of reference.
What do you think, Ismail? Because I think in their inception report, they have indicated these are the objectives, haven't they?
Yeah, they've actually annexed it. So, but I think if someone wants to make quick reference to it, we can put two documents in a folder and just share. They can quickly.
And you could do that, Margot. So you could do both of them, and you could even put there the task force paper that was there. So all three, sort of that reference each other, could be there. And maybe Ismail, one thing maybe is sort of then we sort of catch up. Do you have time? Do you have a few minutes now?
Yes, I do. We can.
It is late for you. I realize now. I'm so sorry.
No,
why am I asking?
Okay. We can just
is that
quickly
okay?
catch up. Yeah, we can just quickly catch up and schedule to talk early next week.
So can we hang on, Margot, just to catch up? Is that okay?
Yeah.
Oh no,
I
you
won't
need
be
to
able
host
to
it,
leave,
is it?
but
Oh dear.
no, which is
Okay.
fine. I don't mind. I just have to. I will hop off. I will just turn my video off and turn mute.
Okay. We can just, okay, thank you.
No
We're not
problem.
going to
And
do
let me
any
stop the
secrets,
recording.
but
I'm going to stop the recording.